How's it going, everybody? It is January 8th, 2014, and I am just a little bit over 2 months post-op. So, I know I took a long time making this video, and I said I was going to make it a month ago after my first one, but you guys know how I am with my videos. They're very scarce sometimes. So, I'm just going to jump right into this. I had surgery on November 5th. 2013 with Curtis Crane in San Francisco. I had double incision mastectomy with nipple graft. My surgery was 2.5 hours or a little under 2 hours maybe, and it's an outpatient surgery, so I was able to go home the same day. I spent a week in San Francisco. I went to my post-op appointment, and then directly after the next day I went home to LA. Since getting back to LA, a lot has changed. In my first month, I probably complained a lot about pain and about how I hated my scars right now and you know, the basics. But I've actually grown past that a little bit right now, even though I'm having some issues with my scars. I have gone through this little period of time where I almost forget that I'm trans because I've had surgery, and I don't have to talk about how I bind anymore or any of the things that, you know, like people ask about pre-operative trans people. So that's actually really nice. My shirts fit. All of my shirts fit. I've been waiting and waiting for 3.5 years for these shirts to fit, and they finally do, so that's nice. I'm not really experiencing too much pain right now because I hit my 6 to 8 week mark, and usually after that point, a lot of people don't really report any pain. So it's good to not have the pain anymore because sometimes it kept me up at night, and I just couldn't deal with it. My sensation and my feeling and my sensitivity are a little up in the air too. I definitely can feel, I definitely have some sensation, but there are certain parts of my chest, I think more specifically closer to the sides by the incisions where they're a little bit deeper. I'll show you later. They're a little numb still, and when I touch them, I don't feel them, but I feel them, I guess. My nipples haven't really come out yet. I'm not sure if they will. They don't look like they're gonna really pop out or anything, but they look fine to me, so I'm not really tripping about it. Like I said, I'm pretty happy about my results. I didn't really experience too many awful things during the recovery process because I just took my time. I slept a lot and I hydrated a lot. I stopped taking the pain pills about 2 or 3 days after my surgery because I just felt like I didn't need them. I felt like they were causing me more harm than good. So I stuck to the Tylenol and the hydration, and I was feeling fine. I have a bit of hypertrophic scarring going on. For those of you guys who don't know what hypertrophic scarring is, I'm going to give you a few examples. Hypertrophic scars are usually red and somewhat prominent at first. Over several months, they're going to become flat and pale. If there's a lot of tension on a healing wound, the healing area is rather thick. And for those of you who don't know what keloiding is, I'll show you an example of that as well. Sometimes scars enlarge spontaneously to form firm, smooth, hard growths called keloids. Keloids may be uncomfortable or itchy and may be much larger than the original wound. They can arise soon after the injury or develop months later. From what I've read, for both of them, they should go away over time. It usually takes about 1 year to 2 years for both to heal, but I've been really, really bad at taking care of my scars. Don't be bad at taking care of your scars. It's bad for you. It's really bad for you. And I can tell because my scars hurt when I touch them still, and that's because I haven't been nice to them. So be nice to your scars. So I have a few things here that I use for scar treatment, and I switch around sometimes because I heard that it's better that way to, you know, so your body doesn't get completely used to one thing and stop working. The first thing I have here is called Scar Zone, and it's got green tea extract in it. And this one's more of a cream. It's white and kind of thick, and you have to rub it in really well, which I really liked because it moisturized it. There it is. It moisturizes it really well. So this one was a good one to work with. Next one I started using was the vitamin E oil. I don't like oils at all, so this is a little bit of an issue for me because it's runny and it's slimy kind of, and I don't like the texture. I also use bio oil, which I'm not exactly sure if it's the same as a vitamin E oil, but it doesn't look like it. It looks like it's a little bit different. Uh it has pure selenium oil in it. I don't know if I said that right, but it's supposed to be better for you than just vitamin E oil. So I actually enjoy this one a little bit better. It's still kind of runny and slimy, but it doesn't run as fast as the other vitamin E oil. I think it's a little more watery in this one. So I guess it just depends on the preference, but me, I like creamier because it's easier to rub in and it doesn't make your hands all nasty like these. But definitely do suggest this one and this one because they have made my scars feel the nicest so far. I've actually heard some things about Mederma as well, and I think I'm going to try that out. I've also got that here. Um, yeah, I mean, I'm just moving around and seeing which ones best work for me. One last scar ointment that I'd like to talk about real quick is called Kilo Coat. A bunch of my friends have been telling me that their doctors and surgeons have been recommending this one. I'm actually going to order it and try it out myself because it looked like it's good. And it's kind of pricey. The cheapest I found it is on Amazon. When I get it, I will try it out. And I will report back to you guys later on how it's working out for me. Working out, I was told at the 6 to 8 week mark that I could start working out again. 6 weeks I started running. 7th week, 8th week, and this is going on the 9th week. I am going to start doing more intensive P90X. So I'm pretty excited to get my body back into a nice place. I've struggled with my weight for a really long time. When I first started hormones, I gained 35, 40 pounds, and it was ridiculous. I was pushing 200, and now I'm safely at 150. So I want to work it down more. I want it to look nice. So that's really what I'm doing right now. I'm going to go ahead and show my scars. So like I always say, excuse the fat. I haven't gotten there yet. So, all right. Are you ready? All right. This is me before 1 month. And this is me 2 months. So the scars have changed actually a little bit since the first month. They were actually a little more droopy and I don't know, they were just more puffy, I think, in the first month. This month you can kind of see more outline of the pec. The scarring's not too bad. Like I said, I'm pretty sure this is what they refer to as hypertrophic, if I'm saying it right. And it's pretty much just a little bit pulled. I'm pretty sure it's just genetic because I have another scar in another place that's also kind of like this. So in due time, I will find out if these will go away or if I will need another treatment of some sort. Let's see if we can get it inside, closer up of the nipples. Alright, so this is left side, right side. My surgeon gave me the option to do straight or curved or whatever really kind of scarring that I preferred. And so I definitely went with the straight because I felt like it contoured my body better. And I feel over time it'll look much better. So hopefully I'll continue to work out and my pecs will raise just right over the scars and they'll blend in and I'll just be all big and macho like this. So, yeah. these are my scars. And this side got cut a little bit more because it was a little bit bigger. This is where I have more numbness and less sensitivity and whatnot. This side is pretty, it's okay. But it looks good. I like it, and I love having my shirt off all the time, so it's a win-win for me. Do I want to put my shirt back on? I guess, since I'm going to talk about scholarships. I want to talk about funding for surgery. That's a big question for a lot of you guys. I've mentioned it quite a few times, but I don't think a lot of people heard me. I won a scholarship. That's right, I won a scholarship, a fully paid scholarship for my surgery. I wanted to talk a little bit about my donor and a few other scholarships that you guys could apply for if you need some help with top surgery funding. The Rizzy to Maine Ministries, they offer scholarships to trans people, men and women, for hormones, bottom surgery, top surgery, transition related things. So the really awesome thing about Rizzy to Maine is that he's part of a church, and he truly believes and preaches that God loves every human being no matter who they are. And even though I'm not very religious, that is something that I very much believe in. The second scholarship that I want to talk about comes from the Jim Collins Foundation. The awesome thing about this scholarship is the foundation was made to honor a man that spent his whole life advocating for trans rights and for people to just live happily, honestly, and with passion. And he was just an amazing ally to our community, and after he passed away, this foundation was made so we could donate money, or they could donate money to trans people that really, really needed their surgeries or their hormones or whatever it may be. The third scholarship on my list is CK Life. That's short for Community Kinship Life. I like I said before, I'm not really sure about these scholarships, how they work, who's behind them. I just know about them, and they're really great. So, CK Life, they're actually about to close off their submissions for this next cycle. I think it's like the beginning of March or something. So it's not too close, but it's close enough. And you really, really, really need to write a really good letter for yourself and have somebody who really knows you and knows what you're about and your struggle through your transition. Have them write a letter for you, a professional, like your doctor, your therapist, someone who's close to you, who understands. That's what happened for me. My doctor wrote an amazing letter, and I'm pretty sure that's why. I'm almost 99% sure that's why. She supported me. She fully supported me the whole way. So she knows where I've been and back, and she understood that, and she was able to translate that for someone else to understand too. So, good luck. I wish you all the best. GoFundMe.com. You can set up a fundraising page, and you can share it on all your social media places. That's what I did for a little while. The money that I raised from that, I paid for my traveling expenses and whatnot. So, medicines, all that. For the Q&A, someone has asked if I was going to donate my binders or if there was somebody I was going to give them to. My answer to that is no, I'm not donating my binders, and I'm not going to give them to anybody because I have used them. Personally, I would not want to give down someone a binder that I have used and sweat in and worked out in and just, lived my life in for the past 2 years. Personally, that's me, and I wouldn't want somebody to give me a binder like that. I do plan to buy one and donate it eventually as soon as I catch up with my bills from being out of work for 2 months from having surgery. So I do plan on getting involved in that. If you guys don't already know, there's a really great program called In a Bind. It's it's a program where you can donate your gently used or even new binders, and they'll send them out to youth for free. So it's a really great program, and a lot of guys need it. So if you don't need your old binders, or you can spare $20, $25 to buy somebody one and just completely make their life, do it. It's a really good feeling, I promise. When did you start to feel like you were a guy inside a girl's body? I'm gonna give a small answer for that one. The second question says, if I'm allowed to ask, when did you start to feel like you are a guy inside a girl's body, and how did you cope with that? Let's see. I grew up kind of what you would call a tomboy. I played a lot of sports. I only wore more masculine clothing. I hung out with boys. I admired my older brother and my father. I was just very male, presenting characteristics, everything about me was pretty male. I got older and I tried to conform to my parents and what they wanted and how they envisioned me, and it worked for a little while for them, but for me it didn't, and I couldn't keep myself trapped in that because I knew that I wouldn't live long if I tried to live a life that wasn't mine. So it took me a little while, but the older I got, the more I started experiencing more life. I was able to just put myself together and figure out how I was going to get out of a situation like that. And when the time came and I was close to 18, I was like, you know what? I'm doing it. I'm going to just be me for once. I'm legally allowed to be me. I can change my name. I can change everything. I can have a surgery. I can start hormones. I can do whatever I want, and nobody can tell me that I can't do it because it's my choice. I'm legally allowed to make that choice, and I did it. I didn't care what anybody thought. So when I started feeling like a boy, I don't know. I really don't, because I've always felt like a boy, and I've always seen myself kind of as a boy. But when I finally came to terms with it, that would have been probably when I was about 15 or 16. I was going through puberty like normal people would at that age, and that's when my body changed, and that's when I realized I was just horrified by what I was seeing because it didn't match. It didn't. Looking in the mirror and feeling and seeing something and thinking something differently, just, it didn't feel right. Top surgery scholarships. How did I pay for surgery? My hair's long, shit. No, seriously. All right. Back down to business. I wanted to talk about my donor for my top surgery. It's called In a Bind. They provide binders to youth that can't afford them. I don't know what I'm doing. What am I saying? I stopped taking my painkillers. See, there it was. I just messed up. My painkillers. I was going good too. Fuck. Was that it? I'm eating pizza. And I also didn't know about other ones, so I just, I keep burping. Too much pizza.